Discuss on T3, T4, TSH estimation by ELISA method and write its interpretation. And the answer goes here. T3 and T4 estimation is based on competitive ELISA. TSH estimation is based on sandwich ELISA. Now, principle of estimation of T3, T4 competitive ELISA. The T3 antigen and T4 antigen in the sample competes with the antigenic T3 and antigenic T4, both in constant quantity and conjugated with horseradish peroxidase for binding the limited number of antibodies anti-T3 and anti-T4 coated on their microplate. After incubation, the unbound antigen are washed off from their microplate. Substrate to T3 and T4 are added. The microplate are incubated. The enzyme HRP in the bound fraction reacts with the substrate. Our substrate is H2O20Mb to produce blue color. Finally, the stop solution H2SO4 is added to both microplate, which changes blue color into final yellow color. The color intensity is inversely proportional to T3 and T4 concentration in sample. The T3 and T4 concentration in sample is calculated through calibration curve. Now, enzymatic antigen plus antigen in sample plus antibody coated on microwave, and Ka is the constant here. These combine to form antigen antibody reaction plus enzymatic antigen antibody reaction. Now the enzymatic antigen conjugated to enzyme HRP constant quantity. Here antigen is native antigen ABCW. ABCW is monospecific immobilized antibody. Ka, rate constant of association. K, rate constant of dissociation. Antigen antibody CW is antigen antibody complex. Enzymatic antigen antibody CW is antigen HRP antibody complex. Principle of estimation of TSH, which is based on sandwich ELISA. Principle is patient sample calibrator patient sample calibrator anti-TSH HRP bound antibody conjugate are added to microvalves coated with streptavidin. TSH antigen in the sample forms a sandwich between two specific antibody. Unbound TSH antigen and HRP conjugate unbound here unbound TSH antigen and HRP conjugate are washed off. When substrate is added, the enzyme reacts with substrate and blue color is produced. Finally, the stop solution is added and the intensity of color is measured with the help of a standard curve plotted against calibrator. The intensity of color is directly proportional to the concentration of TSH in the sample. In reaction, we can see that TSH antigen plus bionylated monoclonal antibody reaction from antigen antibody complex. You can study this reaction. Blue color is formed. Now, what are the lab diagnoses of thyroid function? Measurement number 1, measurement of BMR. In hyperthyroidism, BMR increases. In hypothyroidism, BMR decreases. Estimation of serum protein bound iodine. In hypothyroidism, protein bound iodine decreases. Hyperthyroidism, protein bound iodine increases. Normal range of protein bound iodine is 3 to 8 microgram per dl. Measurement of free T3 T54 TSS. Free T3 normal range is 0.87 to 1.78. Free T4 is 6 to 12 microgram per dl and the normal range of TSS is 0.35 to 4.9. Serum cholesterol in hypothyroidism increases, in hyperthyroidism decreases. Plasma calcium. So in plasma calcium, hyperthyroidism increases. Plasma calcium in hyperthyroidism increases, whereas in hypothyroidism decreases. Now, in hyperthyroid, BMR increases, plasma calcium increases, diabetes mellitus is observed in hyperthyroid, serum cholesterol level decreases, CKMM, creatine kinase MM decreases, creatinine decreases. In hyperthyroidism only, BMR increases and plasma calcium increases. In hypothyroidism, BMR decreases, cholesterol increases, plasma calcium decreases, there is weight gain, sensitivity to cold, dry skin, decreased heart rate, cretinism, myxoedema. In hypothyroidism, cholesterol increases and in calcium, plasma calcium decreases. Interpretation. Let us study interpretation. This is FT3, FT4 and TSH. Here are conditions. FT3 normal, T4 normal, TSH normal, condition none. T3 high, T4 high, TSH low. This is called primary hyperthyroidism. T3 normal, T4 normal, TSH low. Subclinical hyperthyroidism. Okay, T3 normal, T4 normal, TSH low. This is subclinical hyperthyroidism. T3 high, T4 normal, and TSH. T3 high, TSH low. T3 toxicosis. T3 normal, T4 high, TSH low. This is thyroiditis, T4 indigestion. If T3 low, T4 low, and TSH low, thyroid sick syndrome. T3 normal, T4 normal, TSH high. This is known as subclinical hypothyroidism. T3 low, T4 low, and T3 low, T4 low, TSH high. This is primary hypothyroidism. When T3 is high, T4 is high, TSH is high. When all three are high, this is known as TSH producing pituitary adenoma. Note, here are some notes. Causes of hyperthyroidism: Graves' disease, multinodular goiter, toxic nodule, transient thyroiditis. D. Curvens thyroiditis. Here ESR increases and tender thyroid. So 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 this is all about thyroid function test.